Taking a look at our Health Watch, summer is coming to an end, at least for the students, and that first period bell is about to ring. Students are starting the new school year, and all month long we're preparing Coloradans for that transition, which we know is not always easy. So Dr. Lindsey Fish from Denver Health is here for support. So we know summer break means maybe some late nights and sleeping in. So why is reestablishing a consistent routine sleep schedule before the first day of school so important? You can't just start that day.
You can't. We really recommend earlier than that. And it's really important because it's how we get our circadian rhythm back on track for the early wake-ups. And why is it so important? We need sleep and our kids need it for the start of school. Think about how busy those first days of school are for kids. And good sleep is so important to making sure they have stable moods, that they're not irritable, that they're not acting out. It's really important for them to be able to focus well, have good attention, memory, decision making. And the other piece that people sometimes forget about is it's so important for our physical well-being, which is not only for energy to last all day focusing in school, but really let's think about all the germs that are going to spread, so we want everybody's immune system at the best they can be.
Yeah, we need to talk about that later. But how does lack of sleep affect children's mental health as school begins? I mean, it must be so wide spanning that what it affects.
It really is. So we know that lack of sleep really does add up, and unfortunately we see higher rates of people who are sleep deprived, especially children and teenagers, higher rates of depression and anxiety and other mood disorders. And then it's an awful cycle. So poor sleep means poor mood means poor sleep. So really in this time period when we know kids are going to be going through transition, have some extra nerves or anxiety about it, we really want them sleeping enough leading into this transition.
I agree. So what actionable strategies can families and caregivers do to normalize their sleep routine before school starts?
Yeah, so it's start now. 1, 2, 3 weeks before school start is the time to start shifting the sleep routine. So you need to go to bed earlier, wake up earlier, and you need to do it every day of the week, not just during the week. You've got to do it on the weekends too. 1 hour before bed needs to be that calming bedtime routine. So it needs to be quiet time, reading, baths, quiet play, no screens during that 1 hour, because that really screws up our sleep. And making sure the sleep is quality at night. So we need to have it be a dark, quiet, and cool place for our kids to sleep.
When I was pregnant, I read something that the greatest gift you can give your kids is sleep, making sure they have good sleep because it's so impactful. It affects so many different things. So what programs does Denver Health offer for this transition back to school?
Yeah, so Denver Health is just so proud of our 19 school-based clinics that are located on Denver public school campuses, so right in the community for people, and we provide free care to children at those locations. So we're happy to do not only stuff for sleep and mental health, but also all the getting ready for school stuff, those physicals, the well child checks, all that stuff needs to be done to get our kids ready for a successful school year.
Okay, so we're getting back into school. You said your kids start
next week.
Next week, all right. So next week, let's talk about the germs. How do we all stay healthy?
There we go.
Yeah. Okay. Thanks so much for being here today. We're not looking forward to the back to school sickness, but we will see you next week.
Sounds good.